Good afternoon, everyone. We'll be starting the webinar in just a couple minutes. We have quite a few people still joining us. Just let them all get in before we begin. Okay, I think we'll get started now. Hello, and welcome to the Canadian Foundation of Pharmacy's Fall Forum. The topic for today's forum is Cannabis Care, Tools and Strategy for Pharmacists. For those of you who don't know me, my name is Linda Pertula, and I'm the Executive Director of the Canadian Foundation for Pharmacy. As a pharmacist myself, I am so excited and privileged to be helping lead an organization that has supported the profession of pharmacy for 80 years, since 1945. CFP is Canada's only registered national charity for pharmacy, and its mission in 6 words is to help advance the profession of pharmacy. We do that by raising funds for grants and awards that our board of directors bestow on deserving researchers, innovators, and leaders in pharmacy. Through our innovation fund, for example, we've granted more than $2.5 million for over 40 projects, many of which help improve the value of pharmacy service under expanded scope. And we also have Wellspring Leadership Awards that grants up to $10,000 a year for financial aid to foster personal development and leadership. CFP also helps advance the profession through education content, such as today's Pharmacy Forum. This presentation was funded by the CFP's Innovation Fund, a project that was led by Drs. Laura Murphy and Beth Sproule. The panels today we'll be discussing valuable tools and how to best support pharmacists caring for clients who use cannabis. We couldn't do this without donations from individuals and our corporate sponsors. If you're not already a donor, I ask each of you here to consider adding CFP to your personal list of charities. It's an easy and effective way to give back to your profession. I'd also like to say a huge thank you for today's sponsors. Whoops, why isn't it advancing? Our platinum sponsors, Shoppers Drug Mart and Loblaws, and GSK, and Amgen. Our gold sponsors, Pfizer and AbbVie. Whoops. Before we get started, I just want to let you know that today's session is being recorded and will be available on our website after the presentation. Also, if you have any questions, please put them in the Q&A sections and we will make sure that they are addressed. All right, that's enough for me. I'm thrilled to introduce our moderator for today, Maria Zhang. Maria is an advanced practice clinical leader in pharmacy at the Center of Addiction and Mental Health, CAMH, and an adjunct lecturer at the Leslie Dan Faculty of Pharmacy at the University of Toronto. Maria completed her graduate work at CAMH through the Department of Pharmaceutical Sciences and the collaborative program in the addiction studies at U of T. The focus of her research and her teaching in mental health and illness with a focus on substance use. She's also interested in knowledge translation and supporting the continuing professional development of healthcare practitioners. Welcome, Marie.
Thanks so much for having us, Linda. As everyone can see, we're also joined by a panel of amazing pharmacists, and I'm really excited to introduce them very shortly. As Linda's mentioned, the focus of our conversation today is on Cannabis Care Guide for Pharmacists. And again, this was generously supported by the Canadian Foundation for Pharmacy. So we'll go around the room in terms of a bit of an introduction. And I actually really encourage the team and the group in who are attendees to introduce themselves as well, if possible, in the chat. I see a lot of familiar faces, familiar names, and I think it'd just be really interesting to see who else is in the room with us, because I'm assuming you're all interested in this topic around cannabis. After we do introductions, we'll talk a little about the research project that CFP actually supported, and then what it yielded thereafter, which is our Cannabis Care Guide for Pharmacists. And then it actually really dovetailed quite nicely to a cannabis course that I developed with the University of Toronto a few years ago, and we're happy to announce that that's actually now available for free. And then we're going to talk about how we're translating these practice tools to your real life settings, whether that's an ambulatory practice or other spaces. And then lastly, a little bit of a Q&A. So we're really happy to spend the next hour or so with you all. So to start, as Linda mentioned, Dr. Beth Sproule is one of the co-leads to this project. She's a clinician scientist jointly between the Center for Addiction and Mental Health and the University of Toronto. Beth, if you want to say hi, hopefully people can see you as a panelist. We have Avery Loy, who is also a pharmacist. Avery graduated from the Faculty of Pharmacy, did his residency, didn't stop there, continued to do his Master's of Science under Beth's supervision. And this was actually the focus of his thesis project. So Avery is now a clinical pharmacist at UHN, and we're really happy to have him join us as well. If you want to do a wave, Avery. Thanks, Avery. We're also joined by two panelists, Sandra Gerges, who is a classmate of mine, a clinical pharmacist at Sunnybrook Hospital's NICU. And as it relates to this topic specifically, she's a professor at Humber Polytechnic. And one of the projects that she's been a part of in leading is an NSERC funded project focused on pharmacists as cannabis educators, so PACE. I wish I was clever enough to come up with that acronym, but it's a really great project that I hope we're all going to learn a little bit more about during the panel Q&A and how this actually ties in again very nicely to the cannabis clinical guide that was developed by this team. And last but not least, we have Dr. Karen Ng, who is a clinical pharmacist at Women's College Hospital. In addition to the many hats that she wears, she's a co-chair of the Opioid Stewardship Group out of the Toronto Academic Pain Medicine Institute, and also co-chair of the Interfaculty Pain Curriculum at the University of Toronto, which still, I think many people have graduated from U of T, know about that program, and it's only really kind of exponentially increased in size. And kudos to you and your team, Karen, for helping to facilitate that growth. So if you want to do a wave, Sandra and Karen, thank you both. The last person that I wanted to ensure we acknowledged as part of this team is Dr. Laura Murphy. Um, Laura was I guess this was her brainchild. Laura was a clinical site leader and clinician investigator at University Health Network, specifically at the Toronto Rehabilitation Institute. And this clinical guide was born out of her practice in their interdisciplinary pain clinic. This project was, something that she developed through the many conversations that she had with clients in the interdisciplinary team that she worked with. And Laura unfortunately passed away last year. And so this is, our efforts to continue her efforts in, again, translating practices that we see in perhaps highly specialized settings into more generalizable practices so that it can be accessible information beyond, the four walls of Toronto academic teaching hospitals. Of course, all of this, belongs to Laura. So in terms of background, I think all of you are familiar with the fact that cannabis use is quite prevalent in Canada. I think I was even perhaps a bit surprised to see the 2023 Canadian Substance Use Survey really indicated that cannabis is only second to alcohol now, both in terms of use in the last 12 months and also use in the past in the person's lifetime. And so again, cannabis is only second to alcohol. and it actually is quite significantly more than cigarettes. With respect to medical use, which is, I think something that we see, or at least certainly hear about in our clinical practices, approximately 10% of individuals who were surveyed by the Canadian Cannabis Survey in 2024 indicated that they were using cannabis for a medical purpose, and this has actually decreased over time. And then 18% of these individuals indicated that they had a medical authorization. So this was under the clinical supervision of a physician, a nurse practitioner. And again, this number has also decreased with time in terms of the number of people who are accessing cannabis through a medical authorization. I think as pharmacists, we're well aware of some of the harms associated with cannabis, in addition to some of the potential benefits, and certainly ones that are frequently touted in the media and amongst our client basis as well. So we know from a strong evidence-based that cannabis can affect thinking, physical coordination, and concentration, and also certainly increases the risk of accidents, injuries, a whole host of reproductive issues, mental health challenges, including cannabis use disorder. And also, it also increases the chances of lung problems if smoked as well. So, just I think a snapshot of some of the consequences associated with cannabis. And again, these vary depending on how individuals are consuming cannabis, of course. And why does this matter to us? I think we all know that cannabis is not something that's in pharmacists' traditional bailiwick, in that we're actually not part of the formal process associated with cannabis distribution, whether for general adult use or for medical use. At the same time, we are the most accessible clinicians to the general public. I think there are some chains that are also involved in becoming licensed distributors or licensed producers and making cannabis more available to individuals seeking it for medical purposes. And so I think that we've been thrusted, especially in Ontario, into this space where we have a duty to provide care to individuals who use cannabis for a variety of different conditions, some with more evidence than others. We also know that we deal with many medications, particularly in community pharmacy, and there are significant drug interactions with cannabis components. And so, again, just highlighting some of the different roles that we have as pharmacists in this space. And then, really, lastly, and perhaps even in the absence of great evidence for benefits, we know that there's a common sense approach that we need to be taking to substance use in general. And so, this is where harm reduction takes place. And so, the lower risk cannabis use guidelines, which were originally published in 2017, kind of highlight 10 recommendations, technically for people who use cannabis for kind of general adult use or recreational use. But I think these are quite kind of common sense approaches that we should be advocating kind of across the space, whether it's using lower concentration THC, trying a non-smoked or non-inhaled version first and foremost, delaying driving after use. Again, these are just, I think, tried and true and also evidence-backed recommendations to decrease some of the risks associated with cannabis without telling individuals to stop using cannabis or actually use less cannabis. And so this, I think, transitions us into, again, Laura's brainchild, which was Cannabis CareRx, and the clinical care guide that we're going to be speaking about in part as part of this project is one aspect of the greater Cannabis CareRx project that was, again, generously funded by CFP. And in addition to Laura, Beth, Avery, Karen, and myself, Olavo, who I see is an attendee today, and Dr. Andrea Furlan and Rachel Bosma were also members of the project team. I'll turn it over to Avery to speak a little bit more about the objectives for this project and specifically what he did as part of his master's thesis project.
Thanks, Maria. So I was involved in this work as part of my hospital residency project, where the objective was to develop a structured clinical guide for use by community pharmacists to provide care for patients using cannabis. And then as part of my master's work, the objectives were to describe the use of the guide in community pharmacies with patients in order to inform feasibility and also to identify community pharmacists' perspectives on the use of the cannabis clinical guide in their practice, including barriers and facilitators. Briefly, this is what the original guide looked like with one of the sections here, and you can kind of see the rest of the categories listed below. And Beth will overview that a bit more in detail later on. Next slide. In terms of the methods, what we conducted was an exploratory feasibility study using an observational study design. So we recruited 4 community pharmacists to participate with a variety of work experiences, different workplace settings, different prescription counts at their pharmacies to kind of indicate maybe the level of workload. And those are kind of shown in the blue box there. We had our participants complete cannabis education modules that Maria had mentioned to sort of establish a baseline level of knowledge. And then we had them use the cannabis guide in their practice for a period of 3 months. And this included screening patients for cannabis use and then inviting them to participate in the initial consultation where they would use the guide. At the end of the month, the participants completed monthly surveys. That's how we gathered the data. And then we conducted a focus group to gather their perspectives. Next slide. So for the next few slides, I'll briefly go over some of the key results of our studies. So first, in terms of reach, our 4 participants were able to screen 146 patients for cannabis use over that 3-month study period. Around a third of those actually reported current cannabis use, and about 60% of those patients agreed to begin the initial consultation. Again, of those, around 60 were fully completed, and they were able to schedule follow-up consultations with about 20% of them. Next slide. So this slide shows the time required to complete the initial consultations. So you can see those in green, and then you can see the time to complete documentation in blue. The time ranges are kind of along the bottom there, and we can see that sort of the 11 to 25 minute range was the most common for both completing the consultation as well as the documentation. And then there was also a significant portion where pharmacists were actually unable to record the amount of time that it took. On the next slide, we can see some of the demographics of the patients who participated. And interestingly, we saw representation from older age groups, including sort of that 61 to 70 group actually being the most common. Next slide, we can see some of the reasons that patients were using cannabis for. We can see most commonly pain, mental health, sleep, and sort of the other category was those reporting use for adult or recreational purposes. On the next slide here, we can see some info about access and how patients were sourcing their cannabis. So on the left, we see a few different factors. Around 20% of the patients reported working with a healthcare provider related to their cannabis use. And then kind of what Maria was mentioning earlier, how not many were actually getting medical authorization. We only saw about 10%. And then about half reported using other prescription or sort of other medications to treat the same indication that they were using the cannabis for. On the right there in the green, we can see different reported sources that patients were using to obtain their cannabis. The OCS, or Ontario Cannabis Store, was actually the most common, around 40%, followed by sort of obtaining cannabis from a friend or family or from a storefront. Next slide. So here, this pie chart is showing the frequency of cannabis use reported by patients, with about a third of them reporting daily use and almost half reporting just less than daily use. The blue bars there show products and routes of administration. So smoking was unsurprisingly the most common, around 60%, followed by edibles and oils at just around 30%. The green bars indicate the relative THC and CBD content of the products that patients were using. We can see that around 30% were using mainly THC dominant products, while the majority of patients were actually unable to specify any details about the THC and CBD content. Next slide. So here we can take a look at some of the interventions that pharmacists were actually able to make related to drug interactions while having these consultations with the patients. So the blue bar there is showing that during the initial consultations, pharmacists were actually able to identify a potential or actual drug interaction with cannabis in almost half the patients. And the green bar there indicates the percentage where they actually made an intervention. So this is essentially showing that pharmacists were making interventions in around 70% of the patients where they had identified an interaction. And then on the right, we kind of classified the different interventions that they were making. So we can see that recommending to discontinue the cannabis or reduce frequency or dose of the cannabis were quite common, along with making referrals to other healthcare providers to further assess. And yeah, next slide. And also wanted to share some of the quotes that we got from our pharmacist participants during the focus group. Found that a few of these were quite powerful and helped describe some of the themes that came out of this. So a few were, what I found sort of fascinating was, again, going back to the idea that it really boosted my confidence, just bringing it up. And this was a pharmacist referring to using the guide. It felt like you were empowered, you had this tool and you sounded like you knew what you were really talking about. It was great. I didn't recommend cannabis, and the patient was very appreciative because she couldn't find any non-biased information. Her doctor was too busy to answer her, so she was very surprised and thankful that she had this interaction with the pharmacist. And then lastly, one of the participants mentioning that they thought that this type of tool would thrive well once vaccines start to slow down, or in certain settings where they have multiple pharmacists on board and one can be focused on providing specifically clinical services. Next slide. So overall, we developed a guide for pharmacists to help manage patients using cannabis. This was done through an iterative validation process. We were able to establish feasibility in several community pharmacy practice settings. And then in terms of next steps, we are really focused on knowledge translation, including making the guide publicly available, thinking about how education can help support how we use it, and then also how we can integrate into computer systems and, again, make that more readily available. And I'll pass it on to Beth now.
Great, thanks, Avery. Yeah, so in this section, we're just going to describe the resources that we've posted and that are now available for folks to access. Next slide. So we have them posted on a site. It's a CAMH knowledge mobilization site called EENet. And the QR code is there as well as a link. And on the next few slides, those will also be available. Next slide, Maria, please. So I'm just going to briefly go through some of the pages of the guide to kind of give you a better idea of how it was constructed and just some sort of high level kind of overview. In the idea for the guide is to really kind of support and help pharmacists in a sort of a systematic way of asking patients if they're using cannabis, and then all of the key points to try and help them in making that use safe. So the key things about the guide is that this full guide, there's actually a lot of prompts and guidance provided for the pharmacist when they're sort of even wording around how to ask questions, because that was what we were hearing from pharmacists, just to kind of even get the conversation started, and how to work with patients. And so just as conventions, for example, the lighter green boxes that are throughout the guide are supplemental information for the pharmacist to have at hand, depending on how the patients responded to questions. Just some key points that the pharmacist might want to keep in mind in that moment as they're working with the patient. Next slide. So it starts with reasons for use, and then this next portion is around information around accessing cannabis. So in particular, are there other healthcare providers involved? What are their sources of cannabis? Even, their costs associated with using the cannabis, and concerns that they might have around costs or getting information, for example, about their cannabis use. Next slide. The next section is around getting the details of actually what they're using. So the routes of administration, and again, with those lighter green boxes, some in the moment kind of suggestions that they could help with patients around, for example, the smoking route. The frequency of use, amounts, the THC, CBD strengths, and all through that sort of suggested advice as they go along. Next slide. There's a significant section on risk assessment, and this includes a lot of information and prompts around aspects that we know can increase the risks associated with using cannabis. So just, for example, health risks such as having a history of psychosis or use in youth, these types of things. In addition, we have a section specifically on screening for cannabis use disorders. So this helps the pharmacist. It's a validated scale that has just 3 questions, and it can help sort of assess where the person may be at, if there should be recommendations to perhaps be assessed further or more guidance on their cannabis use. Next slide. And this was kind of the trickiest section. This is one section that we ended up changing in the current version compared to the original version. And that's because there's a lot to consider with drug interactions with cannabis, yet a lot of sort of not firm kind of evidence either. And so basically it sort of this section prompts for all the medications they may be using, as well as other substances they may be using, and providing general guidance on things to kind of pay attention to or to look out for. So this section is primarily sort of the guidance in the light green box, but to help kind of guide through that and provide advice and to just to be aware of key CYP interactions, for example. And then we have 5 appendices. So that was the full guide that has all of the prompts and the information. And then in the appendices, there's 5 documents that include a document that could be used to help document what you've discussed with the patient, as sort of a summary to give to the patient. There's appendices that could be used for a follow-up session that you may have with the patient to facilitate documentation as well. There's an appendice specifically on harm reduction to try and help provide advice on making any sort of cannabis use safer. Also, the last 2 appendices are more specific, where one is providing advice around tapering doses or discontinuing cannabis use. And the final appendice is around starting cannabis and some potential titration advice, as well as product selection. So those are available as extra information and supports for pharmacists. Next slide. The other way. Yeah. So as I mentioned, all of these are available currently for download. And this is all of the full guide, which includes the prompts and guidance and wording, as well as we have a version of the full guide with and without the appendices. We have a shorter version of the guide, which basically just kind of strips it down to the key prompts for questions and those green boxes and all the supplemental wording suggestions, those types of things stripped out. And then we have those appendices available as individual documents as well. And they're currently posted as PDFs, and we also have fillable PDF versions that will be posted shortly. And I'll turn it over to Maria.
Thanks, Beth. So I think it seemed like it was so easy to kind of gloss over those elements of the clinical guide, but I think to just want to highlight how much work went into them. I think, Avery's project was really kind of testing them out in, specific settings. We're really keen to get everyone's feedback as we move into this next phase. So when you click on the link or when you scan the QR code, you'll be able to then see a link for folks to actually provide us feedback. I think it's the equivalent of like a phase 4 study. Now we're releasing it into the wild, and we're really keen to get folks and let us know like which versions are you using, which appendix seems to be most helpful with your clinical practice. So again, just wanted to thank everyone who was involved in that iterative process of creating the guide and then testing it and then bringing it to life. Yeah, no small feat indeed. As Beth mentioned, this is the other portion of what we're going to be discussing today, which is something that's actually not directly related to to the Cannabis Care Guide for Pharmacists. This is something that I actually created with the School of Continuing Studies. A couple of years ago, I saw Dawn in the attendee list. So there were quite a few continuing professional development organizations that put together CEP accredited courses in light of the Ontario College of Pharmacists requiring pharmacists to have completed cannabis training, kind of peri-legalization of cannabis in 2018. And so what we were able to do is actually take that course that was previously only accessible after kind of a fee. Now it's going to be available for free for pharmacists through the CPD arm of the Leslie Faculty of Pharmacy. So a big shout out to Kathy Vu for helping us make that come to life. And so just to give you a little bit of a snapshot as to what the course looks like, I can pause a little bit, but it's within Articulate, and it's a pretty interactive and dynamic course that walks through different modules. So one is focused on foundational information. We talk about what's cannabis versus cannabinoids, cannabis effects, kind of going through a body systems perspective. You can see some information around seizures, Lennox-Gastaut, as Beth mentioned, drug interactions, more philosophically and pragmatically, like what are the questions we need to be asking ourselves, as opposed to make sure that clients are not on this drug plus cannabis, because I don't think there's ever anything that concrete when it comes to cannabis, just because cannabis is a pretty short word for almost 500 different chemicals. And so I think, going back to basics is something that we encourage pharmacists to do all the time, especially in the spirit of, facing something that's relatively unknown or not totally clear just yet. So that's module 1 when it comes to foundational information. Module 2 talks about the different existing frameworks that exist, whether that's federal legislation, provincial legislation around adult or kind of recreational use of cannabis. We also talk a little bit about what is medical cannabis, how is this different, what is that authorization document that we were speaking about, and then a little bit of a legal source of a cannabis comparison chart. And while I think the Cannabis Care Guide for Pharmacists was kind of aimed at a community pharmacy audience, this course is open to anyone, including people who work in hospitals. So there's one admittedly small section on managing cannabis in hospital settings as well. So just wanted to flag that for folks. And then in the third out of the 4 modules, we talk about like what are our responsibilities as pharmacists. So looking at, the different position statements put up by CPHA and OCP. Again, for anyone who's not from Ontario, I apologize for a bit more of an Ontario-centric lens to things. And then what does it mean in terms of providing clinical care? So going back to, again, foundations and basics in terms of the pharmaceutical care process. Have we assessed all the different medications that are required? And then there's another kind of mini module on ethical care. It is interesting. Full disclosure, I was on the expert advisory committee coming up with the different learning objectives for the courses that OCP was mandating individual pharmacists to complete, kind of peri legislation in the Cannabis Act. It's stumped me a little bit as to like why all pharmacists were required to complete cannabis education when we are formally not part of the process when it comes to medical cannabis distribution, and certainly not for recreational or adult use cannabis. And I think part of it is one, it's a new topic area, perhaps in general, for some folk. But then two, I think there's a little bit of tension, certainly previously, where I think there were some chains that were more involved in highlighting cannabis for medical purposes for clients who were entering the pharmacy, and leveraging the trust that we have with pharmacists, in addition to the frequent access point that community pharmacists tend to be. So I think calling out the ethics portion is always important as clinicians. And then the last module is a little bit of a translation to practice. So if you're tired of hearing my voice, don't take this part of the module. We do a little bit of role play in terms of, how do you even have a conversation with clients around cannabis? And then doing a little bit of a knowledge check question. And it's quite, again, hopefully as interactive as possible, with fill in the blanks, drag and drops, and getting immediate feedback from all the different knowledge check questions that are there. So again, this one is not yet live. It will be soon, I think, hopefully in the next couple of weeks. And the CPD arm of the Leslie Faculty of Pharmacy will be offering this on a 3 to 4 times a year basis, again, for free for anyone who's interested in taking it. And I also wanted to shout out Sophia Houdani, who is a clinical pharmacist at CAMH, who did a ton of work to update this content and make it just in time for its upcoming release. So thanks for that as well. And so the next piece that we have is to spotlight Karen and Sandra a little bit. As you may have heard in their introductions, they have different hats that they wear, both clinical pharmacists, one in NICU, so hopefully not a lot of kind of involvement with cannabis, but more from the research and the, also Sandra's background in community pharmacy, from that lens. And then Karen, obviously you work in a very kind of concentrated pain service, and also work with a ton of learners in different capacities. And so I'm really curious for you guys, and Avery and Beth, feel free to, hop in as well. And also curious for the folks who are in the audience, you can feel free to type in the chat box. I'm curious as to what you've observed in your conversations with clients who use cannabis, whether that's kind of through your research, through kind of the education groups that you've done, Karen, or conversations with other clinicians on this topic. What are people saying? What are you hearing? And curious as to how you think these tools may or may not be helpful in perhaps facilitating some of those conversations.
You want me to get started, Sandra? If I can talk a little bit. Thanks, Maria and Beth. So as Maria mentioned, I practice in an ambulatory setting in a specialized pain clinic. And I think what we see in our practice is really very much aligned to what we've spoken about, that really the social acceptability of cannabis has certainly increased since legalization. So that leads to a lot of opportunities for pharmacists around questions. I would say almost 50% of my consults are around questions around cannabis and safe use. What is interesting, what I see in my clients more so recently, is around cannabis safety and risk, and even benefits. There's been a shift towards more cautious perceptions around the role of cannabis, and perhaps maybe a greater shift towards uncertainty around its benefits for perhaps pain or sleep or anxiety. And as you know, the data that we presented early on in this discussion, there is some questionable benefits as it relates to pain. So I think this tool has been actually quite helpful for me in practice, even though it's in an ambulatory hospital practice. I don't think it changes how we would approach and frame our discussions with our clients in non-judgmental in a very thorough manner. I personally find the appendices around dosing really helpful. Those are some of the bigger questions that clients often have. You know, the access to cannabis is everywhere. Most of them have come in to my practice using it recreationally, but are curious, does it help with my pain or you know, mood or sleep? I don't know how I'm using it. I don't know my doses, and that's similar to what Avery found, right? That people aren't quite sure what are in the product. So I think this tool has been really helpful to be able to decipher some of these things in a very structured manner and guide patients to use it in the most effective manner. And the last piece is the harms reduction. So that one is super helpful because a lot of the harms in the prompts, the light green prompts, that helps frame the discussion, and often clients aren't aware of some of these harms. So I think if we're able to systematically go through and understand the client's background and medical health history with the guide, it helps to have a really fulsome discussion around safe use.
Thanks for sharing your experience, Karen. Sandra?
Yeah, thanks, Maria. And thank you for including me today. I just wanted to give a bit of a background about our project here at Humber. So we were able to receive a COCOSIF grant, which is a community college social innovation fund over the last 2-ish years. And the whole goal of that was to kind of explore the role of pharmacists as cannabis educators, or we call it PACE. And the PI on the project, actually, he's not a pharmacist, but he is the director for the social innovation group at Humber here. And he kind of saw a vision where pharmacists could be more involved in counseling patients or being more involved in their use of cannabis, you know, with the priority of harm reduction and all those great things that we want to achieve as pharmacists. But he felt that maybe there is a bit of a gap there in terms of the readiness to start doing that right away. And so what we did was we interviewed and we also surveyed both patients and pharmacists across Canada to determine if this is something that's feasible, if pharmacists feel ready, if they see it as part of their role. And we did basically find that about 80% of pharmacists felt that it is part of their role and they were excited and wanted to do it. However, over 65% said they're not prepared to do that yet. And there were, you know, differences in why they weren't prepared. Lots of them said they didn't feel that their education was thorough enough to start giving patients advice right away. There were also lots of comments regarding tools that can be used. So if you get a question in the pharmacy about a medication that you're not familiar with, you can look it up pretty quickly and you feel confident in your answer. But with cannabis, that's not necessarily the case. So pharmacists really did want something to help guide that conversation. And they really wanted something that had more detailed dosing involved, dosing recommendations, drug interactions, harm reduction, all those strategies they wanted to get more information on. And we also did, as part of the project, a scoping kind of environmental scan of what resources are already available to pharmacists. And we found there are some resources, but nothing really all-encompassing or readily available to everybody, and that people kind of knew about and were able to access on a regular basis. And most of the resources that we did find were either focused on pain management or CINV. So outside those two main conditions, there really wasn't so much guidance for pharmacists. So I think, you know, based on our research, this is a really great initiative, and we're really excited to have this you know, come out. And I think it's really timely right now for pharmacists to have access to this. And I think given, you know, the scope of pharmacy schools and the depths of the curriculum right now, it's really hard to continue to add more content into these curriculums. So we'll have to rely on things like this tool and maybe other creative strategies in order to prepare pharmacists for counseling patients.
Thank you both so much. I mean, I do want to maybe turn it over to the chat. I see that there's things bubbling up. I do have kind of like a summary slide and a thank you slide, but I think now might actually be a good time for greater inclusion of folks into the conversation. And so maybe I'll have some elements here. Oh, I see. Thanks, Ajay. So Ajay, who is a former pharmacist at KMH and now a community pharmacy owner, he mentioned that participants can't actually use the chat, so can they just use the Q&A section? So yes, please feel free to use the Q&A portion if you have a question related to this. So there were a couple pieces that were highlighted here. So Vera is a pharmacist at, or maybe I shouldn't presume Vera's a pharmacist, but Vera works at Lake Ridge in Oshawa on the pediatric mental health inpatient unit. Most of the youth are using recreational cannabis as a coping mechanism or for sleep. Do you have any resources or tools specifically for pediatric populations using cannabis? I think our guide is not necessarily aimed at a pediatric population. I think the primary tool that I am aware of, and I think Sandra, like you guys have done some looking into in this space as well, so I'm happy to turn over to you as well. But I know CAMH has an info series called, wait for it, The Blunt Truth. And this was created for youth by youth. And so, Vera, I'm happy to add that to the slide deck for today and then make sure that that's available to you. Again, I think it's challenging, and I think this is perhaps going to, speak to some of the elements that we talked about in this presentation, which is in the absence of evidence. How do we go back to basics? How do we have conversations in general with youth about substance use? And so there's different, resources like drugcocktails.ca that kind of tell folks about, drug interactions with different chemicals, substances, and again, for youth, not by youth, but by clinicians who work with youth. But I think it comes from that space of respecting autonomy as much as possible, but also kind of highlighting some of the risks that they may be at particularly high risk of because of their kind of age and their stage of development. And so, not hopefully like, sorry, it's not the best answer, Vera, but I'm happy to kind of share some resources, both drugcocktails.ca and the Blunt Truth from CAMH. And I think Abir Curry is one of our amazing pharmacists at CAMH who works with our child and youth unit. So Abir, you can feel free to send me a message if we want to pass something along to Vera as well. Again, I'm very blessed to work with a lot of amazing people on this panel and in the chat, so happy to pass along any resources that we can do to kind of support each other and also to support our clients. Anything you wanted to add, Sandra?
Yeah, I was just gonna say I just looked at our review that we did, and I did find that the University of Waterloo in their 5 and 5 series, they do have a whole section on cannabis use and youth resources. So there's infographics and a little video as well that I was able to pull up. So that could be something, maybe hopefully that's helpful.
Sounds good, Sandra. We can perhaps link it either in the slide deck, or Beth, I wonder if we can link it even in our community of practice like landing page that everyone has a QR code now too, as additional resources. So either way, we'll make that accessible for folks. Thanks for your question, Vera. How many community and how many hospital pharmacists are taking part of the webinar? I'm not sure if we can just, Juan, like quickly set up a poll, but I think that'd be interesting if we wanted to put that out there. And Ken had a second question, which was in the survey when it was mentioned that pharmacists wanted to refer the patient to another healthcare professional. Do we know the reason for referral? So, Avery, I think this question's for you and the four pharmacists who are part of your research project as to do we know the reasons for referral? And then the other piece being, had the pharmacist been even better trained on cannabis, do you think in those situations, the pharmacist could have actually handled the entire consultation?
So I think in these cases, it was mainly for management of maybe the other medication that was being impacted, and one that necessarily the pharmacist wouldn't be mainly responsible for either adjusting the dose or recommending alternatives.
Mm.
So not necessarily specifically related to the cannabis. So I think they were comfortable recommending decreasing cannabis use, but maybe not having the maybe not that be that not being part of their jurisdiction to suggest changes to the other potential impacted medication. So I don't think it was a sense that they were not confident to be able to make a recommendation, but just that they would presumably include that information in their referral to someone else who is managing that issue.
Thanks, Avery. So more of a, they literally couldn't proceed with the next steps without a referral.
Yeah.
Thanks, Ken. Thanks, Avery. And then Ken has another question, which is, do we know if both the faculties of pharmacy and medicine have any intention on increasing the education provided to students? And if so, when will it begin? I think yes. The answer is yes. I think especially given that OCP has mandated that every pharmacist has cannabis training. I think this has been a top priority, certainly at the University of Toronto. And as we incorporate all these content in our own CPD umbrella of offerings, it's certainly that's going to be available for our pharmacy students as well. And then, yes, happy to put the link to the Community of Practice website in the Q&A. Thanks, Lee. I don't know if I can have access to the chat either, but we'll make sure that that gets circulated, Lee. And then Heba is asking a question around the link to the course. We'll make that available as soon as it's available. And then someone is asking, so wonderful presentation. I really appreciate the harm reduction piece. I think all healthcare practitioners should at the very least understand the difference between CBD and THC. I've had many patients discussing purchasing high THC products thinking it would be non-psychoactive. A common conversation that I have that has not been mentioned was the fact that this is a natural product. Many patients dismiss the concerns of cannabis because of this and are willing to try cannabis before other treatment strategies. I find that this is important to discuss the severity of the contraindications with patients, even though this is a natural product. I think wholeheartedly agree. Is this something that you see common in your practice, Karen?
Yeah, I see that a lot. Actually, we had a few patients actually yesterday, when they're navigating the cannabis and they're saying, well, it's an herb, right? It's natural. But I think to your point earlier in the presentation that it's just not one plant. It's not just one morphine. It's a slew of 400 plus different components that have very real potential drug interaction. So just framing it that way and explaining that, the cannabis plant is a complex plant. I think we can make it analogous to a lot of our pharmaceutical meds that we have that are marketed, like digoxin, penicillin. Those are all natural items that have very real pharmacokinetic and pharmacodynamic interaction. So I think our role, understanding some of that background and that gentle education can go a far way.
Thanks, Karen. I think flipping the argument on its head is also really helpful for anonymous attendee, whoever you are. Like this idea of you're putting into your body, if it's the dried cannabis version, you're putting into your body 400 plus chemicals without knowing how much of which one is in each and what the impact is of each part, I think helps people conceptualize it as well. Like, I think, especially when people are very like, oh, I really believe in kind of natural products, I want to explore that first. It's like, if you had a cereal box and the ingredient list was 400 different chemicals and 95% of people wouldn't be able to pronounce, I think that would really kind of highlight for folks that yes, it's grown, but it's grown and also in spaces where and with breeding techniques that are actually very scientific in nature, and also still lots to be learned in terms of what each component does, why it works the way it works, does it even work? So I think sometimes to me, like that's part of the conversation as well of like, well, how comfortable do you feel eating cereal that has 400 plus ingredients in it? Because I think it challenges them in in a way around this idea of like just because it's something I can touch, feel, looks earthy, doesn't mean it's necessarily safe. So Rosalind's asking around the CE. Yes, it's just in terms of just managing it because it's going to be available for free. Kathy and her team are going to be opening up a few times a year so that they can kind of issue all the different user IDs and manage it accordingly. So it will be available for access. We will, publicize this through LinkedIn, through social media, through the Lesbian Faculty of Pharmacy once it's available as well. Heba is asking, as a researcher in this area, I find it frequently mentioned that reliable, strong evidence of safety and efficacy are missing. This is also completed by lack of standardized cannabis products. I wonder how the guide addressed both issues. Any thoughts, Beth or Avery?
So I think we do maybe not mention it as explicitly as that, but I think we do stress the importance of sort of at least gathering all the details of their cannabis products to try and illustrate that at least we have the THC and CBD content. But I agree. I think that can be part of counseling to patients. We do talk about lack of standardization as an issue and kind of why we suggest not obtaining from sort of non-legal sources as something that can minimize risks related to that. But I don't know if this is able to tackle the larger issue of lack of standardization. Like even with the different manufacturing process standards that kind of are only found with the medical authorization, we might be able to provide more information that pharmacists can help spread that. But that is a good point. Maybe it's something we could consider adding.
I'll just add that the problem with that also is compounded by, even if you know exactly what's in it, all these different products have not been studied for us to be able to, provide advice on, yes, this is a good combination to use versus others. And the evidence for sort of medical purposes is so limited still and yet used a lot. So I think just having those conversations with the patients, though, to sort of emphasize that fact that, as has been said before, cannabis isn't cannabis, it's not all the same thing. And so it's a real challenge trying to be able to get the evidence base. And there's been a lot of kind of challenges just from a regulation point of view around doing research with cannabis products. And there's just a lot of complications and barriers to that research line or lines. So we really need both standardized products and those products being studied to really be able to feel confident in many ways in our advice to patients.
Yeah, we think what we're all experiencing is that, like, the horses become more, I guess the carriage is, anyways, like the cat's out of the bag in terms of like cannabis is now accessible to people. Unlike pharmaceutical products, where prior to market, you have to go through, FDA, Health Canada licensure. Like you can access cannabis anywhere. And so just as people are not incentivized to get medical authorizations, there's very little incentive for the at least cannabis industry to put efforts into research. I think there are some that are kind of exploring it, but why would you spend money where you don't have to? People are already buying your product, and word of mouth is so powerful. So I think if we continue to wait on evidence before we say anything to a client, we're going to get nowhere because the question's already there. People are already using it, and so I think this is where the clinical guide is giving us, again, a guide to that conversation and like in the spirit of someone already accessing it, for example, how can we support them? Because it's not a matter, frequently, it's not a matter of like if I should use it, but I'm already using it. And how do I go about using it in a way that's more efficacious or safe for me? And I think this is where we go back to, again, to basics of like, can we narrow down the number of products you're exposed to? Can you access a capsule instead of a dried cannabis product? There's a known, 2.5 milligram CBD dose per capsule. So that's much more manageable than, 2.5 grams of cannabis as a dried flower, right? So I think, again, just narrowing down the amount of variability as much as we can in that spirit, I think is quite helpful. I am just cognizant of time, but maybe I'll just say a lot of the other themes in the chat relate to time. Like, who has time to do this? Do we need to lobby the government to give us time to do this? Where do we fit this in the grand scheme of everything, especially as we enter flu season and COVID season? Like, how do pharmacists make space and time to do this? I guess, Avery, like, what did you learn from some of the pharmacist responses in those focus groups? I'm curious.
So I don't know if we got necessarily solutions, but some of the ideas that they suggested were scheduling times for patients to come back to discuss things. At least then they can have it in their schedule to kind of fit into their workflow. But again, they all mentioned it as sort of a barrier that we'll see with like other, especially with like minor ailments and things like that. It's kind of always something they'll have to navigate. But they at least believed it was important and kind of worth making that time in certain cases. So at least that was promising.
Yeah, I think it's going to be, even if this topic was about opioids or something else, like this question around workflow, how do we fit it in, is a tale as old as time. We continue as pharmacists, especially in community pharmacy, have more and more powers, more and more access, more and more scope. And it's not reflective of either remuneration or staffing. And I think this is something that is, you take it to your employer, and obviously, to OPA to kind of advocate for us as a profession, because I think, these services are required. And this is how we prevent hospitalizations. This is how we, optimize, pain management for folks. And so it's really quite important and required, but totally agree that policy change, that advocacy component oftentimes is, the major turning point of like, if there was a cannabis meds check, I think this would certainly change things a little bit for folk in terms of relative priority of your employer in creating time and space for you to do it. I wouldn't necessarily hold my breath on that one, but I think it just kind of speaks to all these different pressures that, yeah, we know everyone feels. Yeah. I think we're at time and a little bit over, but we are happy to receive more questions. You can feel free to email me, maria.zhang@camh.ca, if you have any further questions. Again, we will circulate the slide deck. Linda's recorded today's session, and we are happy to kind of receive your feedback on the Cannabis Care Guide, on the modules once they're, again, re-released in this version. And again, thank you very much to the Canadian Foundation for Pharmacy for having us, for funding this project that Laura spearheaded, was her brainchild, and also to UHN for giving us Avery and Olavo and supporting this whole process. KMH for the graphic design and the editing, and Sophia, who kind of, again, updated all of our materials. And certainly to the Faculty of Pharmacy at U of T, who will soon be hosting the CPD modules on cannabis. So again, very much a collective team effort. And I think this is what we're all doing within our profession, kind of at least making some of the barriers a little bit less high in terms of the knowledge acquisition, the confidence building, the competence. The remuneration and time, we can't solve that just yet, but hoping to brainstorm further options with you guys as we all evolve. Thanks for making the time in your very, very busy days to join us, and I'll turn it back over to Linda to conclude.
Thank you, Maria, and thanks to all of you for a fantastic presentation today. The topic is so relevant today, and the educational tools and the tools that you've created to help pharmacists, I'm sure are well received. I can tell by today's discussion, but will be a valuable tool in the future. So just as the profession continues to evolve, so does the foundation. We did finalize our new strategic plan in early January, and which will allow us to better collaborate with other stakeholders and identify key gaps in research and evidence that are still holding the profession back. This way we can better target our funding to the need to have projects versus the nice to have project. On that note, CFP has developed a short survey, which is available on our website, cfpnet.ca, to obtain feedback from you on where the priorities of pharmacy should be. The survey is open until Friday. It takes about 15 minutes to complete, if that. And this again will help shape the future of the next 15 years of pharmacy. Once again, I want to thank our sponsors, our platinum sponsors, Shoppers Drug Mart Loblaws, GSK and Amgen, and our gold sponsors, Pfizer and AbbVie. And once again, thanks to all of you for attending, and thanks to all our presenters, and enjoy the rest of the day. Have a great one. Thanks, everybody. Bye.